The Waffle overlay, a pressure injury prevention solution, is designed to redistribute pressure and allow airflow, keeping patients cool, dry, and comfortable in both the supine and prone position. Placing patients into a prone position can be a very complicated task that requires an entire team to accomplish. This video is intended to demonstrate the Waffle overlay clinical considerations when placing a patient in the prone position. The versatility of the eHub Waffle overlay provides caregivers various considerations of use with patients in the prone position, based on clinical judgment and facility protocol. With the patient in the supine position, open the red CPR valve to deflate the Waffle overlay. Once the patient has been placed in prone position, ensure the red CPR valve is securely closed and inflate the overlay. Using the included MAD pump, place the nozzle into the clear valve. Inflate to the number of strokes indicated near the valve on the Waffle overlay. Once inflated, it is important to verify the patient is offloaded by performing a hand check. Slide your hand between the overlay and support surface, beneath any area at risk for pressure injury, such as the lower rib cage or the pelvis. Your hand should slide easily underneath the patient. If it is difficult to slide your hand under the patient, additional strokes of air are needed. If you cannot feel the area at risk for a pressure injury, tap on the clear valve to release some air. Return the bed rails to the proper position. First, lock the wheels and lower the bed rails to remove the Waffle overlay straps at the head of bed. While one caregiver maintains the proper position of the patient head and neck, two caregivers grasp the top corners of the overlay and gently fold it underneath. A folded Waffle cushion is placed underneath the patient's head to provide pressure redistribution and help prevent facial pressure injuries. Lower the bed rails and remove both Waffle overlay straps at the foot of the bed. Each caregiver grasps the bottom corners of the overlay and gently folds it underneath to offload the patient's toes. The caregiver on one side of the bed grasps the overlay handwells. He or she hands off the overlay to the caregiver on the opposite side while slightly rolling the patient. Place the first position perfect wedge just above the waist area and the second just below the hip area